I wish you all a very good morning and welcome you to this 4-day workshop on mental well-being, neuroscience, and meditation starting from today. For conducting this workshop, we have with us Dr. Usha Vastare and Mr. Vasant Jaju. I would like to give their short introductions. Dr. Usha Vastare is a distinguished neuroscientist and author and social worker. She has been a faculty of Temple University School of Medicine, Philadelphia, USA for a period of 17 years. Post her career at the Temple University, she also essayed the role of Clinical Research Project Coordinator at the Center for Parkinson's Disease and Movement Disorders, Pennsylvania Hospital, Philadelphia. She has published over 70 research papers and abstracts in reputed journals and contributed to 5 books used for continuing medical education course. She was academic research advisor for MDs, postdoctoral fellows, PhDs, and master's students, and has been trained in hospice care for terminally ill. She is the co-founder of non-profit and voluntary service organization called Yogakshem. Yogakshem aims to bring the confluence of science and spirituality in their talks and workshops. Over the 15 years, more than 30,000 people have attended in about 1,000 such workshops and have testified to the benefits derived from them. Mr. Vasant Jaju has done his master's in microwave engineering from IIT Kharagpur. He has worked in cellular and satellite communication domain for 17 years for several MNCs both in India and abroad. About 14 years back, he decided to quit his corporate career lifestyle to explore meta questions behind life and sustainable living. Since then, he has been volunteering his time for various NGOs. He has attended several workshops and conferences on yoga, alternative therapies, forgiveness, mind training, Vipassana meditation camps, sustainable living, science and spirituality confluence, and many others. He has been a long-term mindfulness practitioner and is also keenly interested in yoga and Ayurveda. Both he and his wife share their experiences and learnings by conducting yoga therapy classes for diverse sets of audience from children to senior citizens. He is also a director for wellness for Yogakshem. Usha ma'am and Vasanji, I welcome you to this workshop and we can start today's workshop. Over to you.
Thank you. Thank you, Ravish bhai. Good morning, all of you, and it's a great pleasure for us at Yogakshema to be part of this holistic healthy living course. Today's topic for the workshop that we're going to cover over the next 4 days is titled as Mental Well-Being, Neuroscience and Meditation. Some of the aspects of this workshop might have been covered by the previous speakers in various different contexts. However, I would urge you to relook at them afresh, not just as a reinforcement, but in the context, in the way we will be connecting these topics with the base of neuroscience. While we are covering these various neuroscience concepts, would like to urge you to try and relate these concepts in the context of your daily routine or your life experiences. That is something which I feel is extremely essential to get the maximum benefit of this workshop. If certain concepts tend to become abstract, if one is not able to relate to that, feel free to stop then and there and just put forth the question to give some examples in the context of daily life so that we do not miss the bus. Of course, we'll have elaborate Q&A session at the end of the workshop, but if there is anything that is blocking you in the context of what is being spoken, you are most welcome to stop there itself, and we'll be happy to take any questions. The presentations will be primarily will be in English. Dr. Usha Vastare, we call her as Usha Auntie, she can understand English or Kannada. However, if you would like to ask questions in other languages like either Hindi or Gujarati, you're most welcome to do that. Ravish Bhai or Bharat Bhai can help us translate from Gujarati to English. Over the course of next 4 days, we have also planned out various experiential meditation sessions. Again, some of those techniques may have the same terms that you might have already been covered by the previous speakers. However, we would once again expect that you pay specific attention to the instructions, which will again be related in the context of the neuroscience concepts, so that you'll be able to understand the common aspects of various different types of meditation techniques rather than getting confused with various different types. Of course, from tomorrow, we are also planning to have a small test at the beginning of each session. So request you to be alert. Okay, with this, let me try and share the slide. You are able to see the slide, Ravish Bhai?
Yes, Vasanji.
Okay.
There are some black boxes on the top of the slide. I think something in the background is open.
Oh, is it so? Okay. Let me try again. Is that okay now?
Yes, the slides are visible, but some black boxes, I think the controls of the Zooms are coming in and going out. So it is fine. We can continue. Yes.
Thank you. Okay, we will be covering this workshop over the next 4 days, and broadly we have divided these into these 4 topics for each of these days. Today's day will be primarily talking on health and wellness, understanding the differences between them and also the common aspects between them, and specifically paying more attention towards mental well-being, and also relating that with the issues with connecting to today's world with regards to mental wellness. Given that we've been having COVID since last 1.5 years, I'm sure all of us have gone through some challenges or the other in this realm and can easily relate to the importance of mental well-being. We will focus on day 2 on some other neuroscience concepts. Day 3 will be focused on various aspects of meditation, starting from mindfulness meditation to some of the very common aspects of meditation, the purpose of meditation, some of the misconceptions behind meditation, what is meditation and what is not meditation. All these aspects will be covered on day 3. On the last day, we have planned to focus more on forgiveness and its relevance in the context of our day-to-day life for our overall mental well-being. So this is going to be the broad structure over the next 4 days. Now, before I hand over to Ushanti, would like to quickly practice for about next 5 minutes mindful breathing. So I'd like to urge all of you to gently close your eyes. Let's keep our back and neck straight. Let the mind be relaxed. Let us relax our facial muscles, neck muscles, let us take some slow and deep breaths. Let us feel our posture. Align our weight distribution on both the sides. And with a calm and quiet mind, direct our entire attention inside the nostrils. Just feel the breath flowing through the nostrils. Watch the breath. Observe the breath. Let us find out whether we are predominantly breathing from the right nostril or left nostril. Or maybe simultaneously and symmetrically from both the nostrils. Whatever it may be, just feel the nostril dominance. Let us use the breath as a powerful tool to remain deeply anchored with the present moment. Here and now, now and here. Both the mind and the body at the same place at the same time. As we are observing our breath, thoughts may pop up. So be it, without judging ourselves. Gently, kindly, and compassionately come back to feeling the breath. Let us remain connected with the breath. Breath may be deep or shallow. Maybe fast or slow. Just become aware of the characteristics of the breath and let it be natural, normal breath. But remain associated with the breath, the life force within us. Let us remain aware of each and every breath. And the entire stretch of the breath as it is. This simple practice of mindfully observing our natural breath is called Anapanasati meditation in the Buddhist scriptures, or is called as Pranadharana in the yogic scriptures. Now let us end this mindful breathing practice by chanting Shanti Mantra. You may join the palms together in Prarthana Mudra. Inhale. Om. Shanti, Shanti, Shanti. You may gently rub your palms over each other, generating a fondness. Keep your palms over your eyes, eye muscles. Relax your eyes. Give a gentle massage to the facial region, neck region. And looking at the palms, gently open your eyes. Thank you. That was a very simple but extremely powerful mindful breathing practice. More about the science behind this simple practice. We'll cover it specifically more on day 3, but some of the aspects we'll also be covering on day 1 and day 2. With this, I would like to request Dr. Usha Vastare Ushanti to start her presentation. Thank you. We are not able to hear you, Auntie. No. Would you like to mute and start again? Just mute and unmute and try it out. No, not yet.
Maybe joining the Zoom meeting again might help. If you can exit and join again, it might help.
Yeah. Otherwise, she could dial in from the phone. That could be other alternative.
Okay. Can you hear me now?
Yes, we can.
Very good. I went back to my old system. So let me close this up. Sorry about that. All right. In the next 3 days, I would like us to accomplish 4 things. First and foremost is to understand mind, body, and behavior connection. We easily understand that there is a very close connection between mind and body, but we need to also understand our behavior is also connected with this interaction between body and mind. That is number one. Second one is to understand and remove the stigma that is attached with mental health issues. That is simple and straightforward. The third thing is, for many of the mental health issues, absolutely certain medications are absolutely necessary, no doubt about it. However, recent research shows that just treating people for mental health issues is not enough. Along with treating people with certain psychiatric medications, various other types of therapies are also extremely important. Fourth and foremost is this. Along with therapies, there are many other issues that we need to understand about ourselves, about how our brain works, how our mind works, so as to make this kind of knowledge about ourselves, self-knowledge, then this knowledge itself works as medicine. This is the whole crux of it, that knowledge about ourselves can be used as medicine to be able to overcome many of the mental health issues and also lead a life full of zest. So, another aspect along with this is there are many mental health conditions. It could be depression, especially subclinical depression, mild depression, moderate depression, and many varieties of anxiety disorders can be treated in a non-pharmacological way. This is where both Yogakshema and Nisargopachara Kendra, we have been striving to educate the community in this regard so that we can use our thinking patterns and the way we feel about certain things and the way we accept the reality itself, and to be able to change some of those thinking patterns that will bring us down so as to cause some imbalance in the chemicals in our cells is one of the foremost interests of both these institutions. In this regard, very soon, in a couple of months, we are going to launch a retreat or a program to treat depression with non-pharmacological ways to overcome that imbalance in the chemicals that would be present when somebody is going through depression. Having said these goals for ourselves, let us try and go a little bit deeper into these aspects. I hope you're able to see my screen. Ravish?
Yes, ma'am.
Yeah, thank you. So first and foremost, let's understand what is health and the difference between health and wellness or well-being. We are all aware of this definition by WHO, wherein health is not just mere absence of disease, but it is a state of complete physical, mental, and social well-being. We are very much aware of this, so I'm not going to go into greater detail about this. But what is the definition of wellness and well-being is all about? Wellness encompasses all these issues. First and foremost is to have this childlike enthusiasm to learn and to be compassionate and kind, just like children are naturally kind and compassionate and curious. In a similar manner, as adults, we need to actually work towards being lifelong learners and to be compassionate and kind. Also, to develop zest for life. To develop zest for life even until our last breath. This might surprise many people, but it is possible. It is possible to develop this zest for life until our last breath. This is what is all about quality of death and dying. We have heard about quality of life, but have we thought about quality of death and dying? Many times when we even hear these phrases, it feels like a taboo. But when we go deeper about understanding the quality of death and dying, we come to understand it is all about living the life to the fullest extent. So as much as we need to learn about quality of life, we need to know and understand about the quality of death and dying too, so that we can live an enriching and fulfilling life. And this enriching and fulfilling life comprises of many things, and just to name a few, is to have that emotional stability. Yes, in life it is very common and it is natural to have many ups and downs. Many times every day we are faced with situations wherein there could be ups and downs with our emotions and feelings. That is natural. In a similar manner, we need to be able to bring back those ups and downs in a neutral fashion, to have that emotional stability, that sthita prajna state. And it is very much possible. Yes, we know some of the tools and techniques, including what Basanta went through, the mindful breathing, that is one way. But just using tools and techniques are not going to be enough. What is more empowering is to know how these tools and techniques work on our brain and mind and on our behavior. To go into that why of anything is what is really crucial. And science is all about that, going deeper and deeper to why, and not just stay at how to do anything. Tools and techniques, we can get many of them, but why we need to do and what happens inside us when we use these tools and techniques is very crucial. Along with that, to have clarity in our thinking process, especially when we have emotional ups and downs, it is very easy to get many doubts and to be also confused, rightly so. But to be able to get these solutions and answers that are within ourselves is the key. And that is what we're going to learn the next 3 days, how to figure out those answers that are already within us. And very importantly, the ability to love others. And not just to love others, and to also serve others. Extremely important to love and serve others. Not only that, and there could be many changes that come about in everybody's lives. And there are many uncertainties, especially about the future. And how to be able to embrace these changes that happen in our lives, and to face and deal with uncertainties, and not only just deal with uncertainties, how we can blossom and evolve through those uncertainties that are present in everybody's future. When we go through all of this, what is the result? We naturally become altruistic, and we develop an attitude of gratitude that results in kindness. Ultimately, having a meaningful and purposeful life the means and the end to that meaningful and purposeful life is this: developing an attitude of gratitude, and to have an altruistic nature, and to be kind both to ourselves and to others. So, with this definition in mind, let us go through and understand health, our own health, and our own well-being under many different situations, and see how we can actually adjust, adapt, go through these various health and wellness, well-being situations, and also how we can evolve through these situations. I've taken 4 different scenarios to understand this aspect. So let's first take, it happens at times for everybody, very unfortunate situation, does not matter what age, many a times our health is not that great. Keep in mind the definitions of health and wellness and go through these slides. We may not be as healthy, and we may not be as well also because of ill health. It's an unfortunate situation. Both of these can happen, and it will happen in everybody's life. And it may happen many a times also. Another situation is we could be young, hale, and healthy. Or we could be middle-aged, hale and healthy and highly successful. Or even older and hale and healthy physically. But we are not as well. Neither we have the emotional stability, nor can we love and serve our own loved ones, let alone the strangers, which makes us not as well. Our well-being is not at our peak when this happens. Then it is not possible to lead an enriching life or a fulfilling life, no matter how successful we are in the eyes of our own family or the society might be highly successful, highly educated, very wealthy, but without all of those of clarity in thinking, loving and serving others, emotional stability, we will not be able to lead an enriching and fulfilling life. And its third scenario is, again, whatever age it may be, we may not be as healthy, but we are, according to the definition that we have just gone through, we are extremely well. Our mental well-being is at its peak. In spite of illness, we can be well. And this scenario, especially as we get older, because statistics say as we get older, our health conditions are not as great for most of the people. However, we may not be as healthy. We might have some chronic illness, but if we have trained ourselves to be mentally well, this is the most desirable stage for any age, and especially during old age. Another scenario is, which is ideal, again for all ages, be one may be young, middle-aged, or old. The ideal situation would be that we are both healthy and we are well. Our mental wellness, our mental well-being is optimal. These are the 4 scenarios, and let us see how we can relate this to how we can evolve through these 4 scenarios. The first 2 scenarios, obviously, we go through life, what we call it as survival mode. We deal with these scenarios, we adjust, we adapt, but we may not be leading an enriching and fulfilling life, with a life full of meaning and purpose, a life full of zest. As I mentioned, we could be highly, highly successful. We have reached the pinnacle in our career, but yet we will still be just surviving if we have not figured out the meaning and purpose of life, which is the whole crux of optimal mental well-being. We will still be in this survival mode. Whereas the 3rd and 4th scenarios that we talked about, even if our health is not ideal, even if we are going through some chronic illness or temporary illness, it doesn't matter. But if we are leading a life full of meaning and purpose, loving, to begin with our own family members, our own loved ones, and extend that to others, including the community, this is when we will start evolving. And this is when we will be able to lead a life full of zest until our last breath. So to sum up this, in these 4 scenarios, as you can very clearly see, yes, health is very important. But even if we have some sort of temporary illness or long-term illness, if we have figured out how to lead a life of optimal well-being, figuring out the meaning and purpose of life, and learning to lead a life full of zest. This is where we will be evolving. Keeping this in mind, let us just go through and see what is it that prevents us to have optimal mental well-being. And if we don't have that optimal well-being, that is again, it is a barrier for us to be evolving in our lives. So ultimately, what is it that is preventing us to evolve into better human beings, to be loving and to be serving others, and to be leading a life full of zest until our last breath? So what is it that prevents us? As much as it is important how to develop all of this, even before that, we need to understand what is it that is preventing us to evolve and to lead a life full of zest. And it says it's our own mind that is preventing us to evolve. And this Bhagavad Gita shloka says it all, which is Bandhuratmat manastasya enatmainatmana jitaha anatmanastu shatrutve vartetatmaiva shatruvatu. It says our own mind can act like a friend. Our own mind can act like an enemy if we have not trained our mind, if we have not conquered our mind can act as either as a friend or as an enemy. Usually, under various different circumstances, our own mind acts like our own friend, and at other circumstances, our own mind acts like our own enemy. And the whole crux of it is to understand this and to train our minds and to conquer our minds so that we can make our mind as our friend rather than as our enemy. The take-home message for this slide is this. Yes, our own mind is our problem, but the solution for this problem lies in our own mind. So the solution for most of the things that we are looking at, yes, that does not mean we cannot solve certain things by looking at external situations. I'm not saying at that level, but ultimately the solution lies within us. Even if the problem is outside, even if we are going through stressful situation at work or a difficult relationship at a personal level, which means the problem might be outside, but the solution is always inside. Again, that does not mean there could be solution outside. That is a different angle. Here we are going to see, irrespective of whether we are able to find the solution outside or not, if we dig deep within ourselves, we will be able to find the solution within us. This is what true evolving means in a scientific way, and not just in the scientific way, and also in the spiritual way also. We always find a solution that is within us, and it is already within us. That is the beauty of it. The solution is already within us. We just have to understand how to manifest this solution within ourselves. And that is the whole crux of the next concept that Vasant is going to take it forward to see what is it that prevents us to evolve, and what is it that makes our own mind as an enemy, and what is it that helps us, our mind, to be our own friend. It's all yours, Vasant. Take it away.
Yeah, sure. Thank you. Before we move on, I thought this might be a good step to pause and take any questions, because this concept of health and wellness and the way it has been related in the context of some of the core aspects with regards to the whole meaning and purpose of life, surviving versus evolving, I feel is very, very crucial. So we could, if it's okay, we could pause and take any questions if anybody has. When you particularly related about old age, yes, the health, the body has to eventually give up and decay. It has to go through aches and pains and things like that, particularly during old age. It reminded me of my grandmother, even at the age of 87, 88, despite having her chronic knee pains and all that, her zest towards life and enthusiasm was something that really, those thoughts really came back to me. She would get up early in the morning at the conventional Brahmi Muhurtam time, do her meditation, and then start with her day with Rangoli, taking care of the joint family, cooking for everybody. And right till the end, even while we are sleeping, she will be always available to tell stories to us when I was a child. So it really brought me those fond memories of my grandmother. And that helped me to relate this difference between health and wellness very clearly.
So true, Vasant. Even when we hear such anecdotes, we get goosebumps. But all of that now we have to learn through science, through going through scriptures, a deeper understanding of scriptures. But our grandmothers, our forefathers lived such a natural and organic life. It came very natural to us. That's fine. As long as we can acknowledge, appreciate such a type of life, and especially with the help of science and our scriptural knowledge, all we need to do is to put some effort and bring that back in our lives. That is how I feel.
Yeah. There was a question on the chat box to have the presentation in Hindi, but I would say this will be primarily in English. Usha Aunty can only follow English or Kannada, and the other most common language that we always say that she follows the language of heart. However, feel free to ask your questions either in Hindi or Gujarati or Marathi, or there may be some other people who know other languages, and we will translate that in English and have it responded.
Yes, Vasanji, we have few questions. We have few hand raised. So by one, we can take 2-3 questions. So Neeta, you can ask your question. Yes, now you can unmute yourself.
Hello, good morning. It's a pleasure to meet you, ma'am, and Vasantji. I would like to ask you, I'm also into the field of psychology and I'm trying to heal many people. And sometimes I'm going to talk about myself here. That in spite of knowing everything, in spite of practicing everything, when on and on you keep on getting triggers, traumatic triggers, you keep on going down and up. You keep on going, then again you come back, but there is a dip. how can you prevent the dip?
Okay, it's a great question, Meeta. That is natural for it to happen, as you rightly said. And it comes back, as you know, one of the yardsticks that we have to know is how soon does it come back? We have a formula, we say FIR. The frequency of these ups and downs has it decreased. Sometimes it may not. The intensity of that up and down has that come down. It may or it may not. But the third one is a sure way to know, and we should also work towards that, which is the recovery time. How fast we can come back to the neutral level. That is very important. That is at an individual level, but how we can hasten this process, Meeta, no amount of intellectual understanding and going through that ourselves will be enough. To be amongst people with sharing similar values and philosophies, extremely important. This is what we call it as satsang, in Sanskrit. When we are in that satsang, you will see, and that is what happens both here in Yogakshema and with the Nisargopachara Kendra. How soon we come back, and the ups and downs are not as high and low. Not only that, when we do this, we come back with the gusto being better than before. And not only that, the process of coming back becomes a joyous one, because we don't focus on the downs, but we focus on we are coming back. When we come back, it is not to the original level, but to a higher level. This is a sure way when we are with that satsang. When we go through this ourselves at an individual level, we keep coming back to that original level. But this is the power of satsang. Each time we come back, we go back to a little bit higher level. We go back to a deeper level than before. This is the surest way I can tell you. And it will be a joyous one too. Thank you.
Thank you. Just to complete my question, another one. Is it true that kinesthetic people feel even more, in the body and mind? I mean, So.
Yeah, it may be so, but let us get into a meta level without labeling, because not everybody is a kinesthetic person. Different people have different personalities. So we're going to learn these neuroscience concepts and how to put it into practice in the next 3 days in such a way that it is going to be common for everybody, not just for somebody. And you're right, the feelings for everybody, feelings are expressed at the level of body. That is for certain. And the more sensitive person you are, that is what gets expressed at the body level. Now, especially we can feel that when we have when we face a negative situation, or even a positive one for that matter, but much more so negative in a negative situation, which is what Vasant is going to deal with that in the next 2 minutes. But apart from that, 1 second, sorry. The feelings are expressed at the level of the body, but this, because of that sensitivity, now that being sensitive enough is working as a weakness for us. However, we can make this as a strength once we know why that happens, and that is the segue to Vasant's next section. So whatever we feel right now, because we feel the negative things much more at the level of body, now that has become a weakness, how to convert that into a strength is the issue. Thank you, Meeta, again.
Yeah, I would just like to add one of the things that I tend to remind myself when going through a down is only when we go through a down, there is really a genuine and deep inquiry. And I try to remind myself as that's an opportunity to evolve and to understand ourselves a little more deeper. Because when the things are going up, again, that's an opportunity to find out ways to serve others. But continuously things going upward, I'm not sure whether there will be enough opportunities that we can grab to evolve. So,
True.
we can take maybe one more. I think Dharaben
Yes.
had a question. Yeah.
Amit Soni has raised his hand, so I think we can take his question.
Sure.
Amit ji, please ask your question.
Sure. Thank you so much, Usha ma'am and Vasant bhai. My question is regarding, because I am working full time at a corporate, and because of this pandemic, mostly everybody is working from home, and sometimes even I'm running one session called Art of Mindfulness. I'm a trainer. So what is happening, which I've seen it, is most of the people are not aware of they are in stress, because they are only feeling when there something happens in some situations, some trigger happens with something. But apart from that also, like if they are working overtime, they're doing 3 morning to night, sitting on the one room in front of laptop, but they're not being aware. They're just going through with that mindset of overthinking and back to back. So how we can enable that thought, they need to take some pauses, or are we going to cover those aspects of this like 3-day sessions, because that is something which is more grounded level and practicality. When I'm seeing that people are getting stressed, until unless they are not feeling, so for example, if they are feeling not well, or maybe they are having suffering from some kind of illness or something, then they realize, oh, we need mental well-being. Otherwise, they will not realize. They will continue doing this, and until things are happening at the end.
Great question again, Amit. And not only, especially now with this question, we will make sure we will weave in, and then we can use these questions as we go along in the next 3 days. That is for sure. But also not just what to do, how to do, but this to bring that self-awareness, attending and going through workshops, not just like this, throughout this holistic healthy living course, is the whole crux of it. We need to, when we become lifelong learners, we don't wait, and we don't need to wait. We don't have to wait until a crisis or an emergency or something happens to our health. When we develop that quality of lifelong learners, even when everything is going great, we can try and bring this awareness, because the key word there is awareness. That self-awareness is the key. Self-awareness about ourselves, what is happening at the level of thought, at the level of our notions, our feelings, our sensations in the body. That self-awareness is the most important quality of a human being. And this quality of self-awareness is what distinguishes us as humans from the rest of the animal kingdom. So we need to develop this self-awareness more and more and more. Thank you. Thank you for that question again, Amit.
Yeah.
Yes, Vasanji, I think
Yeah.
we can
So,
continue.
yes, we will move on. I would like to share the slides now. So after having covered aspects with regards to difference between health and wellness, connecting that to survive and evolve, and what is it that prevents us to continuously keep enhancing our wellness or to keep evolving, is what I'm going to talk about as to what is it that really prevents us. And Auntie has already given us the leading thing with regards to our mind, and how our mind can be both our friend as well as our foe. And one thing that we would have observed, given the very nature of our mind, is to really swing like a pendulum between past and future, and being very difficult to remain in the present moment. And that, particularly when we are going through difficult circumstances, when we are going through some racing thoughts, we would find that it's very difficult for our mind to remain in the present moment. What exactly happens if we look at it is we tend to look at past with regret, and the result of that, we again swing into and project that past experience with that regret into future with anxiety or pessimism. While if we really look at the whole concept of time, whatever needs to be done, whatever actions that need to happen, whatever decisions that need to be taken, can only happen in the present moment. That doesn't mean that we cannot learn from the past. In fact, we should learn from the past. That doesn't mean that we cannot plan for the future. Yes, we need to plan for the future, but being deeply grounded in the present moment. While what tends to happen is our past unpleasant memories or experiences, or the biases that might have formed because of repeatedly processing those past events in the same way, that tends to govern us and make our mind to swing between past and future like a pendulum going back and forth. So it is essentially this aspect that we would like to focus on, and one of the core neuroscience concepts that we would like to talk about today is the whole concept of negativity bias. And it is this negativity bias which is innate within all of us. When I say all of us, every single person on this planet, the 7 billion population, essentially has this negativity bias. Whether the person is a child or an adult, or a president or a pauper, a beggar or a corporate executive, a homemaker or a social worker, whosoever it may be, each and every person essentially has this innate negativity bias. One might wonder, why has it been endowed on us by the Lord? Of course, it has its significance. It has its evolutionary significance that we'll talk about it later on. But what does this negativity bias essentially mean? It basically means that we have a tendency to get more easily attached or attracted or ruminating over negative experiences, negative events, negative circumstances, negative thoughts. All of that tends to get attached to our brain much longer than the equal intensity of positive events that happen to us. Both of them happen to us, both negative and positive. And with the recent research in the neuroscience that has happened in the last 2 to 3 decades, it has been well proven that the negative events get stuck in our brain much longer than the equal intensity positive events. So this is something that we need to remind ourselves, particularly when we become aware that we are ruminating over certain negative events. If I were to give a simple example, quite often when I'm standing for catching the bus, and when I'm waiting to get the bus in the right direction, the most common thoughts that come to me is I tend to count more often and look at the buses that are going in the opposite direction rather than the bus which are going in the same direction. And I say that whenever I stand on the bus stop to catch a bus, it's always that the buses in the opposite directions are more frequent. Now that's again because of the negativity bias within us, because we tend to relate these negative events, and many times I've got the bus immediately, but that gets quickly forgotten, but because of this innate negativity bias. And now this has been well proven with the evidence-based scientific research that has been done, the various kinds of brain scans that have been done. Usha Aunty will talk about it more later on. That these negative events tend to stick with us much longer. Now, if you try and relate this with your own life experiences, I'm sure you will also be able to come out with situations when, whenever this negativity bias tends to trigger within us. One of the examples of one of our faculty members gives is he lives in an apartment. It has about 17 stories, and whenever he's trying to catch a lift, he says that he always sees that the lifts are going in the opposite direction than direction in which he wants to go. And then he reminds himself saying that, oh no, it's probably a negativity bias. And to prove that, he actually did a very scientific study of noting down every time he was able to get the lift in the correct direction versus the lift going in the opposite direction. And he actually found that 60% of the time the lift, he was able to get the lift in the right direction. But what gets reminded again and again because of this innate negativity bias is the lifts going in the opposite direction. Now, with this negativity bias in mind, all of this starts with what we call as automatic negative thoughts. We're using the word automatic here is because these negative thoughts pop up within us automatically. We don't have to make any effort towards it. They just come without any effort, and one tends to look at the external situation or circumstance or event as a result of these, with these automatic negative thoughts as a lens in between. The first three alphabets of these three letters, we call it as ants. And just as in nature, we have various different types of ants. Some may be very harmless, simple, small black ants. Some may be bully ants, which can really sting us, bite us, or some may be even very extreme, which can be very harmful, like the termites. But one of the characteristics of these ants is they, and even with our thoughts, is they come one after another in a straight line, and sometimes it can really snowball in a particular direction into us. And these automatic negative thoughts can really make us feel unpleasant at the level of the body, and we may even land up taking actions for which we might regret later on. So again, reminding ourselves of these negativity bias. As I said, these negative thoughts stick within us, within our brain, like a Velcro. And we all know what a Velcro is, and it becomes very hard to really pull it out and decipher these negative thoughts. While the positive events or the positive experiences that we go through or the positive thoughts that we have, they just get washed off like a non-stick or a Teflon coated pan that we are all used to. They don't create an equal impact within us as much as the negative thoughts. And we get frustrated because we do not know how to overcome this negativity within, either in ourselves or in others. Of course, we'll focus more on overcoming this negativity primarily in ourselves. Quite often, it's also not possible that we are not even aware of these negative thoughts. But however, as and when we become aware, we find that if these negative thoughts or negative experiences are not examined, and if they go unchecked, if we are not able to question those negative thoughts, these unchecked, unexamined ants can affect various dimensions of our life. They can affect, most important is our interpersonal relationships. Until we'll talk about the interpersonal neurobiology behind all of that, it can affect our work, our productivity level at work, our efficiency level at work, our enthusiasm to work. It can affect our health. And to sum it up, it can really affect our entire life. And these unchecked and unexamined ants are essentially the cause of imbalance in our neurochemicals, and which can result into one or more or a combination of various mental disorders. Now, this again is extremely important because one of the core neuroscience concepts, which we'll cover in more detail tomorrow, is that each and every thought within us releases a chemical within our body. Of course, positive thoughts release positive chemicals, and the negative thoughts release negative chemicals. And because of this excessive amount of negative chemicals, it can result into various kinds of mental disorders, or even simple things like anxiety, panic attacks, and so on. And in extreme cases, it can even result into clinical depression at either mild or moderate or severe level. And these negative ants essentially have characteristics that they do not allow us to remain in the present moment, here and now, now and here. That's why we use this practice at the beginning of the session to just remain deeply anchored with the present moment. And breath is a very, very powerful tool that we all have right from the time we are born till we die. Just by observing the breath, we can quickly get anchored, at least for that short duration, in the present moment, and not allow these unpleasant negative thoughts to snowball in one particular direction. And breath, as we know, is also a strong bridge between both the mind and the body, and helps us to bring both mind and body together at the same place, here and now. Otherwise, we fall back into this habitual, automatic, autopilot mode of looking at the past with regret, and without our awareness, the mind tends to project into the future with certain anxiety, and the whole result of that is our present remains unsatisfactory. We are not able to take the right actions, the right decisions, whatever needs to be done in the present moment, here and now. Now, none of these are probably new to most of you, given all the presentations that have happened earlier or what you might have read by yourselves. But these are the typical excuses that quite often one tends to give for oneself. And if we really look at these excuses, in some sense, if we repeatedly keep giving these excuses, we are sort of further enhancing or further increasing the problems with regards to our mental well-being. Quite often, we even tend to blame it on genes, saying that I'm like this because of the genetic makeup, because with whatever little we might have read about genetic engineering in the newspapers. But today's research has proven beyond doubt, the science of epigenetics, that the expression of these genes is essentially within our hands. Expression of these genes is dependent both on our internal and our external environment. While we might be predisposed to certain genetic conditions or genetic makeup or even certain tendencies, but being able to not express that is clearly within us. And of course, blaming it because of external situation, either a spouse or a parent or a friend or a boss, again, are the most common excuses that can happen unconsciously to us. Or I'm like this because of external circumstances, because of the situation around me. And the consequences of all these repeated excuses on ourselves is basically we cannot change easily, although we desire to change. We also shun away from responsibilities. We can't be proactive. We cannot properly plan for the future. We cannot learn new things. And in the end, of course, we cannot be what we want to be. Of course, behind all this, there is, of course, no magic pill that can be popped up. But essentially, as Antti had said, that the answers as to how to overcome all this essentially lie again within our own mind. Some more consequences, yes, we cannot be as much loving and empathetic as we want to be. And at the end of the day, we cannot be more happier as we would like to be. And the attempt over the next 3 days is primarily to enable us to understand our brain and mind through this knowledge and use that knowledge to essentially work on ourselves. And this knowledge in various ways can, of course, serve as a medicine. Of course, that doesn't mean that we cannot use the pharmacological approach, but the focus for the next 4 days is primarily on non-pharmacological approach, which is again needed even if the medicines have to be used more to complement our overall wellness. So with all this, what is the quick fix that we have for enhancing our mental well-being? I think most of you would have already got the answer, is to keep reminding ourselves to come back to the present moment and drop all those shoulds and haves or the excuses that we have for ourselves for taking the right actions with regards to our health, which could be simple things like getting up in the morning, going for our walks, and instead of depending on new years to come to make another resolution and then falling apart, taking that action then and there on day-to-day basis, on a moment-to-moment basis. So the essential crux and a quick fix is to keep coming back to the present moment, here and now, now and here. And of course, doing the right thing. Quite often we know how to do the things right, but doing the right thing, what is needed in our context, each time, every time. And it's not just thinking about the right thing and not doing it, but also feeling it in our body and then doing the right thing. So the example that I mentioned about doing the exercises and getting up in the morning and doing it, one of the best ways is reminding ourselves as to how we have felt whenever we have been able to do it, and plan for it for the subsequent day, and with that right thought and feeling, act upon it and do it. So with that, I would like to once again ask Usha Aunty to take over the remaining part.
Yeah, thank you, Vasant. Okay. I just want to spend a couple more minutes on this slide because there was a question in the chat box with respect to interpersonal relationships. So I want to relate this slide that Vasant just ended and then relate to the question on interpersonal relationships. Whenever we have some difficult relationship, it's not just enough thinking positively about that relationship, about that person, and just feeling within ourselves, oh, it's gonna be fine, or this is a passing phase and whatnot. Much more than thinking the right way, feeling the right way, putting that into action in the proper way. That's the case. If it's a difficult relationship, that the way to evolve is for us to show that kindness, to be more compassionate, to be more understanding, and to love that person even more than otherwise. So doing the right thing, if we focus on that, sometimes that will help even more than changing at the thought level and feeling level. This is what we call it as both inside out approach and outside in approach. Yes, we need to start at the level of our thoughts and our feelings, feeling the right way, thinking about that person in the right way is very important. But at times, doing things the right way with that particular relationship, and then that will lead to changing the way we feel about that person, the way we think about that person. So both are needed. This is again a very quick fix, but we will also go into greater detail how this will affect our brains, our mind. This is what that rewiring starts to happen when we start doing the right thing first. Or we can end up doing the right thing. Ultimately, it is about doing the right thing. It is about the action, because any time we focus on the action can only happen in the present moment. Thinking and feeling are mental constructs. We can be thinking about the past, we can be thinking about the future, feeling about the past and future, but the action, when we do this at the action level can only happen in the present moment. This is the quick fix. Even before we think and feel it right, that takes a lot more effort. That takes a lot of training to be thinking and feeling right each time and every time. But just focus on doing the right thing. And then automatically, or with some effort, we will start feeling and thinking about it properly. So this is about being in the present moment, because being in the present moment is very much related to our actions. Because actions, our own actions, our own behavior, whatever we experience through those actions and behavior can only and only happen in the present moment. This is a very powerful slide and a very powerful concept. We want to hone this in, and we want to get this right. Why being in the present moment is so very important. Because that is the only time we get an opportunity to do the right thing. With that, I'm just going to conclude in the next few minutes. Again, we talked about this Bhagavad Gita shloka about mind training. As we train our minds, and I always say there is nothing like a trained mind. There is an untrained mind, of course, but there is nothing like a trained mind. A mind should always be in training. As we experience more and more novel things, meet more and more newer people, and to be facing uncertainties about the future, we need to be training our mind each and every moment. So it is always a mind is in training. So when that happens, we get to a level of what in Bhagavad Gita they talk about conquering the mind is nothing but another Sanskrit term for that is Manojayaha. And we can actually feel that when we conquer our minds to overcome some negativity or some old habit, not calling people on time, as simple as that. We don't think all of this is negativity. We think this is our nature. I can't do anything about this nature. And as we move higher and higher up in the ladder, these things become unimportant. And we think we will start living with these habits. Without our knowledge, it is affecting ourselves and also affecting others. Then when we overcome these each and every moment, this is Manojaya. And we can feel that in each and every cell of the body at an individual level. And when we are working in the team, we can feel that in the group. This is what we have experienced this as a team, both in Yogakshema and Nisargopachara Kendra, when we work together as a team. And this message is what we want to portray to others. When you work as a team, when you work as a family, within the family, and as you train your mind, as you conquer your mind, as Manojaya happens, happiness ensues, joy ensues. We cannot work towards being happy, towards being joyous. Happiness and joy become the byproduct. This is whether just at the family level, whether at the level of our friendship, whether with respect to a community, or at workplace, or in an organization. If whatever we do is not bringing us joy and happiness, we need to dig deep and understand and reflect on these concepts, which are really, really broad and a meta level. And this is where, again, I stress the importance of answering Meeta's question. And the answer to that was satsang. So who we work with, the family becomes a satsang. This is actually the result of a meta-clinical study. What that means is there were many different studies that were done. But after the studies that were done, the data was collected, certain type of data, which I'll go through what it is, and many various different types of statistical analysis were done. And we come up with this, what we call it as key symptom cycle for diseases. What were the studies? These were the studies in US wherein data on inpatients in many hospitals were taken. These patients, inpatients, these patients had come to the hospital to be admitted, to be treated in the hospital for very length of time. It could be as simple as for some surgical procedure, or for treatment of chronic illnesses. Irrespective of the condition, they collected the data to see what were the symptoms that were common amongst all those patients who were admitted to the hospital. Over a length of period, and this involved thousands and thousands of data points. When this was done, we came to understand, irrespective of any disease, people had these symptoms. And again, this is not a cycle, one symptom leading to another. Just saying these are all the symptoms that were expressed in those patients who were admitted for many different reasons and causes and different diagnoses. Of course, we can understand pain is the most common thing. And because of pain, it might lead to anxiety about the future because of the uncertainties of the future, what brings in, and depending on the severity of the illness, that could cause sadness, when untreated could lead to depression. All of this getting expressed at the level of the body, as Meeta was saying again, whether one is a kinesthetic person or not, irrespective of that, everybody will experience this tense muscles. Different people have different soft spots. It could be for somebody neck, it could be somebody back, middle back, lower back, whatever it is, tense muscles. And because of all of this, repetitive thoughts about uncertainties about the future and anxious nature of the mind, feeling sad about themselves and about the family, leading to fatigue, not being able to do much because of fatigue, which is fatigue can be caused because of two reasons, either physical fatigue or mental fatigue. Lot of this ending up with shortness of breath, much more than that, shallow breathing. Now you see how that initial mindfulness, such a simple mindfulness breathing technique, could help with that shallow breathing. Once we start breathing in a normal way, naturally, as we keep practicing that, our normal breathing itself deepens in a natural manner, in an organic manner, helping us to bring our focus back into the present moment. Because as soon as we focus on our breath, breath is the bridge between our body and our mind. Our mind races elsewhere, goes out. We might be sitting here, but the mind can go to Moon or Mars in a fraction of a second. And to bring that mind back, having that anchor as the breath, being grounded in our breathing, helps a lot. All of this resulting in difficult emotions in such a manner, and especially in West, many of the people who are admitted to many of conditions, illnesses, doctors have realized these difficult emotions. It's so hard to deal with, whether you're a surgeon or a non-surgeon. They usually these days bring in a psychiatrist to deal with these difficult emotions, whether they be in a temporary manner or they will know what can lead to a chronic situation. This we can understand. But what Yogakshema deals with, and this is the crux of the matter, what we have seen in the past 15 years of experience dealing with thousands of people. Of course, we have not done any meta study. None of these data are subjected to rigorous statistical methodologies and analysis to come up with statistical significance differences. But I can vouch for this, having dealt with thousands of people. All these symptoms that we see in this key symptom cycle of disease is not restricted to any disease or illness. Even people who are healthy at whatever age, starting with young kids to retirees, all of these they face, and especially difficult emotions in day-to-day situations. I'll just give you a simple example. Again, I forget the name. I think it was Amit. Is in a corporate setting. Imagine, Amit, few years back, not during COVID days, just few years back, everything is going great. But you have a serious argument with your teenage daughter or with your spouse on something that is very crucial and very sensitive to you. That morning, that day, that morning, you have a serious discussion which leads to argument, which you don't want that, but it leads to an argument. And you have to go back and focus on the work. Yes, if we are true professionals, yes, we will be able to set aside, we will be able to compartmentalize our mind and go and focus on the work. Many of the professionals, we have learned to do that. But along with focusing and doing the work, whatever that little neck pain one might have, that gets aggravated that day. Or it could be a headache. Or you get tired by the end of the day without your knowledge and you wonder why. Many of these difficult emotions, which also happen at the subconscious level, is acting at the level of body, acting on sensations, as physical sensations. Without our knowledge, this happens. And now, take this COVID situation. This is day in and day out. So much uncertainty about the future, causing anxiety, leading to stressful situations. Anxiety, we know for a fact, leads to stress. And boredom, staying at home in one place, in one room, staring at the screen without much contact with your colleagues, again might lead to stress, which means it is a day in and day out situation. Soon, COVID has become a chronic situation, especially with respect to stress. And what happens to those difficult emotions leading day in and day out? And we know for a fact that depression rate has increased, especially during COVID times, and especially in countries, third world countries, or I don't even want to use the word because that word is obsolete, developing countries, which is seen even more so. And especially in cultures like in South African cultures, wherein sharing our difficult emotions, and especially if you're a man in developing countries, sharing these difficult emotions, either with your family or with your friends, when it is a taboo, imagine what happens. So all this situation is not because of some chronic illness. This is the study that was done, meta-analysis study, looking at statistical analysis. But this is what we have seen year after year. People of all ages, of all socio-economic, educational background, we see this again and again. This is the whole crux, understanding the cycle again. This is the foundation for mind, body, and behavior connection. Until and unless we have this inside out and outside in approach, we will not be able to solve many of the things that are happening within us, because again of lack of self-awareness, which is also because of lack of knowledge about all of these things. Once we are exposed to this kind of knowledge, naturally our self-awareness will increase. Until and unless you have the right atmosphere, which is what I call it as satsang, from a Sanskrit term, or the right colleagues, right team members in a group, this will not be a joyous experience. Understanding this and putting this into practice, because it becomes so hard to put it into practice, we shun it away. We don't want to think about it because it creates cognitive dissonance. Until and unless we have the right team, we won't be able to overcome that cognitive dissonance, because until and unless we enjoy this process of understanding and putting this into practice, until and unless that becomes a joyous process with the right people, it becomes extremely difficult. So I end today again bringing back the importance of interpersonal relationships starting at home, at work, with colleagues, with friends, and especially with the team members in an organization. Until and unless we have this greater understanding, we will not be able to tackle that issue, that not these things happen not just because of an illness or a disease, but also in day-to-day situations, day-to-day circumstances that we face on a regular basis. With this, I'm going to close and open up the floor for more question and answer questions. And this is what we are going to keep going deeper in the next 3 days. Thank you.
Thank you, Usha ma'am. We can now take questions, and those participants who want to ask any questions related to today's discussion may please use the raise hand option, and I will call your names and then you can put your question. Yes, we have one participant. I cannot see the name, but it's written as iPhone. You can unmute yourself and you can ask the question.
Thank you, Ravishbhai. Good morning, ma'am. I am Dr. Shwetal. Ravishbhai, sorry, it's a new iPhone, so I forgot to name it.
No problem.
Ma'am, I had like many questions, but being a pediatrician, I would like to first concentrate with the profession. Why my patients are ill? What are the emotions, difficulty they are facing?
Oh, that's your question for when the patients are ill, what are the difficulties?
Yeah, I feel very
like, oh, absolutely.
There's a small, tiny people. That small, tiny soul has, why he's suffering?
Let me answer the first one. I didn't get the second part, that what you said. You're a pediatrician, so you get kids of all ages. If they're very young, it's in fact easier to handle because not much emotions. They young babies and young kids up to a certain age, they just deal with that comfort. As long as they are comfortable, even if they have illness, as long as we make them comfortable and secure, especially when they're young, that is enough for the kids. It is the caregivers who face these difficult emotions much more than your patients. And as the age of these kids increase, then we see again, the main thing is either about the pain or the fear of what is going to happen, the fear of unknown many at times. So as simple knowledge as, in the simplest terms, not that the patient or the kid has to understand about everything about the consequences of the disease, but just as simple as one aspect. Oh, this is a passing phase, not to worry, you're gonna be fine. That is enough, both for the patient and for the caregiver, because as a pediatrician, you have to deal not just with your patients, which are children, but also the caregivers, the parents, the siblings, and just trying to tell them with full of hope that this is a passing phase. as long as it's an acute one. If it's a chronic one, there is a different way of dealing with this aspect, saying that this is a passing phase, that it will improve, it will, they will feel much better than what it was before. Laying down the facts, which should be facts, and in a simple manner that they can handle, we can cover most of the difficult emotions that they go through. As I said, the difficult emotions of the caregivers would be, oh, what will happen to my kid? And how long is this going to be? Especially if the parent is a working professional, both the parents are working professionals, that is the first thing that comes to their mind. How long will this prolong? Will I be able to take time off to care for my own child? And sometimes guilt of not being able to be with the child if the parents, both the parents are working parents. So these are the things. Immediately giving that hope, saying that this is a passing phase, that is enough. And again, as a quick fix, again, this is where affirmations come in very handy. Giving affirmations, repeating the affirmation again and again and again will help them. Saying that this is a passing phase. It is there is a phrase in Pali, not Sanskrit, but Pali language, which is anicca. Anicca means it's a passing phase. Things will pass. It will get better soon. That is enough. If they keep repeating that, it is anicca, things will get better. That is enough, because again, rewiring of the brain happens when we use affirmations. Affirmations can be used as medicine for short-term, immediate medicine. It can act as an immediate medicine. And when we repeat these affirmations, when we repeat with full understanding and with full josh, or with the right feelings, it will literally act like a miracle. And how that happens, we're going to see that tomorrow.
Okay.
The how behind the rewiring of the brain. Thank you.
Thank you so much, ma'am. One more thing, ma'am. You just like the example of Mr. Amit and the daughter's discussion. So with the teenage, there is, I don't know, there must be some difference in the thought process, right? Their adolescent age and our. So
Yeah.
this is going, ma'am. How can we, like, it is not for easy for everyone to achieve the manojay. So we are going to react, right? With we, because as a parents we are going to see the, we always see ki whatever the things they are doing just now is going to affect the future, and we are worried. So in that case, that is going to affect, headache is going to happen even if you are in your profession, wherever you are. But if there is some difficult discussion at home, and you, everyone is going to have that, adolescents and the parents generation. So in that case, how to be neutral, how to
Yeah.
not react or not feel that emotional difficulty.
Sure. It's not about not feeling emotional difficulty. We are people. We have emotions and feelings. Naturally, we will feel. And rather than reacting, when Manojaya is a big word, as it's a process, it's not a stage to reach. As long as we know we need to be doing this, that is the most important thing, because it's easier to repeat these things. But until and unless we start putting this into practice, even as medical professionals, caretakers, caregivers, if we don't put this into practice and just repeat the words, it will not work with others, especially as medical care professionals. As we practice this on ourselves, this is where it gets the credibility. All of this, especially knowledge as medicine, what we're talking about, whether it's with depression or anxiety, we might deal with a little bit of anxiety tomorrow. And also in the next couple of months, we're going to be using this as a way to treat depression, people with depression in a structured manner over a period of time. until and unless the people who are dealing with other people, patients with depression, if we have not put this into practice, it will be seen like that. We will not have the credibility. We need to walk our talk, otherwise it will not. But walking our talk does not mean, yes, sometimes we will fail, we will react. So be it. Remember that FIR I talked about, and we will repeat that FIR again and again. We have to have our own yardsticks. Am I getting better? Am I being more calm with day after day, on a moment-to-moment basis, not on a day after day? And focusing on the things that we have dealt with in a positive way is the crucial aspect. And that energy is what is others, our own patients, our own loved ones will feel that. Ultimately, it is using non-pharmacological ways to treat any of these mental health issues. If you have observed, I'm using the word mental health issues, not even mental disorders, not even mental illnesses. It is tough. I have to remind myself every time, rather than using mental illness, mental health issue. And sometimes it comes, mental illness, it's okay. Even changing our own language makes so much sense. So this is a process, and we need to walk our talk. And especially when it comes to mental health issues, the others, whether it is subclinical depression or it is common general anxiety disorder, they work at the level of how much we are practicing rather than just preaching. Ultimately, this is what it is all about. When we use concepts for mind training, let us just say mind training rather than Manojaya, that comes later. If we don't walk our talk, it shows. It will not work. Not even on patients. Even if we are talking to other people at the corporate level, I can assure you it will not work. Then we are just going to be trainers. They will label as trainers. This is the difference between trainers and educators. If we have to be educators, we need to walk our talk. We need to be practicing whatever we are. I don't want to use the word preaching, that is the old phrase. We need to be practicing what we are saying. Otherwise, these non-pharmacological ways, using knowledge as medicine, will not work. This is the beauty of it, which means it is two-way. It is so powerful, so empowering. It also helps the people or the practitioners, and also helps the people with mental health issues or physical health issues or any stressful issues. This is the two-way aspect. Both the person who is helping and who is being helped, both of them together, they evolve, they become better. This is the secret of
Thank you, ma'am.
integrative medicine. Thank you.
Thank you, ma'am. Thank you so much.
We'll take next question. Sanjay Bhai Trivedi.
Namaste, Usha ji.
Namaste.
From this series of lectures, we know that everything is on mind. Okay, whatever the problem, whatever the emotions, life problems or whatever, and we know that also. And the shortest definition of happiness or sorrow is the state of the mind. But I was thinking that suppose a person is standing on the wavy platform it is shaking at very high frequency. Okay. And I am standing on that, or I am sailing in the ship and ocean is wavy. Now I am trying to balance myself, and this waviness and frequency of shaking is our systems which we have worked out from since thousands of years at social systems. There is a marriage system, education system, political system, judiciary system, and at every moment of life, we are part of one system, or we are interacting with that system or persons. And these whole systems based on the emotions. For security purpose, we have developed this marriage and society, fear, pleasure. And this platform is so shaky, and we are trying to balance ourselves. So it will not work until and unless I get down from this platform.
Okay.
So
Great question, Sanjay. I got it. I want to stop that question and answer because I'm so eager to answer. You're absolutely right. You have really thought about it so well. You know, it is not about stopping the system. We will take the analogy that you yourself gave, that you're on the sea and it is so wavy. That is the nature of the system is that we cannot change. We need to accept. This is the reality. How to accept the reality, we will, in the next 3 days, we're going to cover it probably on the 3rd day. We need to be able to accept the reality. If we resist the reality, this is what's going to cause stress. That is one definition of stress, is to resist the reality. The reality is that, as you rightly said, all the systems are shaky. It is going to be like that. We cannot change the external world. Only thing we can do is to change ourselves. How do we change ourselves? Take that analogy of the sea. Many a times, without our knowledge, we travel on the sea with 1 foot in each boat. This is what makes it difficult. We really need to know what are our values, what is our philosophy, what is it that we want in our life. Is it to change others, or is it my peace of mind, my happiness, my success also? That is also extremely important. My success in the most dharmic way, so that I can be happy and I can also make others happy if possible. When we are going through this without our knowledge, at times we have 2 feet in 2 boats and we are traveling on this sea, which is so wavy. Once we realize that, have both feet on one boat and see, this is what mind training is all about. This is what Manojaya is all about. This is one of the surest and crucial characteristic of anybody who has led a team. A team within the family, that team, that leader doesn't have to go work outside. It could be that grandmother, like Vasanthi talked about in the beginning. She will be able to keep that whole sea at bay. We really need to know what we want in our lives. And we need to have the definition of success, not the definition of success what others see, what the society sees. We need to come up with our own definition of success, which should be related to the definition of well-being and wellness.
one more question.
Then
Sorry.
we don't need to change the system. We change ourselves, just like what Gandhi has said. You be the change that you want to see in the world, and things will fall in place. Great question, Sanjay. Thank you.
Sir, one sub question related to this. After so many efforts, we are not able to do this. What I think is, in Shastras, I had asked this Palar Sahib also, there are 3 things for this suffering. The ignorance. So what you said, that knowledge is necessary to know first why this suffering. Second is distraction, mind distraction. So emotions and all this. But third level is impurities, which lies in chitta, and it comes from birth to birth, so many births.
Absolutely.
But what is that technique? Because this subconscious self-hypnosis and everything works on subconscious level, but above subconscious, there is unconscious and so many things.
Correct.
So that
Great.
impurities we cannot remove. So suffering is continuous.
Yeah, great question again, Sanjay. I can see how all of this comes from life experience to not just personal and also seeing amongst others. What you talked about, absolutely right. The first one is ignorance, and the knowledge is going to help. Just knowing what we should do is not going to be enough. What prevents us by to do what we want to do is very important. That's what Vasant went through, our negativity bias. We talked about ants in a scientific term. That is what it is, the impurities of the mind. These are the ants, the Arishad Varga. Kama, Krodha, Lobha, Moha, Mada, Matsarya is nothing but our ants. And we're going to deal with the next 3 days how to overcome this negativity bias. We're going to go into the tools. Vasant gave a quick fix, what we should do to be back in the present moment. That is the first one. We're going to keep going deeper and deeper as we go along. We'll definitely give you the technique. So what prevents us to understand this knowledge? First, understanding the knowledge, that is where the resistance is. And sometimes we understand at an intellectual level and we think we are okay. It does not so. Understanding is at an intellectual level. The brain cannot get rewired, or the wiring cannot happen if it's only at the thought level. Only when we put it into practice will there be results. So we're going to go into that tools later. And again, I'm going to keep coming back, especially in the initial stages. We have to be away from the environment which brings us more impurities and focus on the people who will help us to grow together. That is that satsang. I'll just leave it at that because I think we're going over time, Ravish.
Thank you.
Yeah. Again, thanks for that question, Sanjay.
Ma'am, we have 2 more questions. If time can permit, we can take the questions. Dimant Bhai Trivedi.
Yes. Hello. Can you hear me?
Go ahead.
Yes.
Yeah, my question has been partly answered by your answer to Sanjay. Basically, see, the consequences and the reasons for the mind not following the right pattern has been highlighted by Vasantji. So my question is how to overcome it. And you said that you will be covering it in the next 2 days, so that answers partly the question. So
yeah.
Thanks for that.
But he also gave a quick fix, which is also very important.
Yeah,
just
that's
to
true. Yeah.
practice the mind to keep coming back to the present moment. And that is the tool that he used in the beginning, the mindful breathing. So each and everything what we have put together has a reason and a time and place for it to be understood. So we can assure you, you will get the whole picture by the end of the 4th day.
Thank you. Thank you very much.
Sirish Vasisht.
Yeah. Hello. Can
Yes,
you?
Sirish.
Yeah. Hi,
Yeah.
everyone. Kushanti and both you and Vasant spoke about the recovery time and the process of recovery and stuff. So you mentioned that the recovery can be joyous, and one of the things which Vasant does is he goes into the deep inquiry and introspection and stuff. So this is a twofold question. One is in my personal experience, when I do that, I think it leads to more guilt, and I tend to overthink, and when I do introspection and everything, I tend to overthink, and it leads to me ending up more feeling guilty, more guiltier. And the other thing is one of the the solutions is like quick fix was like being present and to, like say avoid negativity bias. And also you mentioned about satsang. So the other thing is, one is how to avoid feeling more guilty, and the other one was like, when you mentioned about satsang. So I kind of, noticed that when I'm going through that recovery period, so I feel like I want to isolate myself, like, be in a cocoon, or like say not interact with people. So how do we take that next step to be in touch with people, like, the right kind of people? And so, yeah.
Great question, Suresh. Two-part question. I will take the second part first and then the first part later. How to be all of this, and then based on your experience, all of this, because you just understood your own mind, or why you're behaving, acting either with yourself or with others in your own way, which you knew best. But here, when we attend a course like this, not just these 4 days, by the way, the entire course, when we go through, we will get a much deeper and better understanding of ourselves, of others, and the environment. The reason I'm using satsang, when we talk about environment, it is not just about the environment that we use in the common parlance word. The environment about the people, that satsang also is extremely important. So when you go through this in a very highly structured way of understanding, naturally, if you don't resist the learning part, because what we are sharing is not our opinion and suggestion. All of this, in this entire course, this is all evidence-based research. If we truly believe in science, and if we believe in evidence-based research, then we need to accept, and then the next step is to follow after accepting. So that is the difference. Forget about what has happened until now, because we did, not just you, all of us, we have done all of the things that you have said. That does not mean to belittle your experience, but to tell you, most of us, when we go through the suffering, this is what we have done. Now I can laugh at it. 30 years back, 40 years back, this was not a laughing matter. I would have felt as guilty as you would feel right now. This is the process. When I say satsang, it's also people who are in different stages of transforming themselves, not just people who all think in a similar manner. That is also not very healthy. We need people who can think from various different angles, but they're committed to transform themselves. Even that is a big word. They're committed to become better people, and to, even that is bigger word, they're committed to lead a life full of zest and more of joy. If they're committed to lead a joyous life, if that is the common factor, and even if they have differences of opinion, in fact, that is healthier in that group, in that satsang. Thank you.
Right.
I think I combined both.
Yep.
Very
Thank you.
Question.
Yep. Thank you.
Yes, Usha ma'am, I think we have covered all the questions. So for today, we can conclude the meeting and today's presentation. So it's a beautiful beginning and start to this 4-day workshop. And I'm sure we are all going to enjoy this 4 days of workshop with you and Vasantji. And I thank you very much for all the knowledge, information, experiences shared by you and Vasantji. Thank you very much, Usha ma'am and Vasantji. Namaste.
Thank you, sir and madam.
Thank you.
I'll be ending the meeting now.
Sure.